Assalamu alaikum dear students. Here we will discuss ABO blood system MCQs part 3rd. Antibodies for the ABO blood group are present option A on red blood cells, on white blood cells, option C on platelets, and option D in plasma. So the correct option is D, in plasma. Here a short explanation is antibodies for the ABO blood group anti-A and anti-B are naturally occurring and found in the plasma, not on blood cells. They develop early in life due to exposure to similar antigens in the environment. In the ABO blood system, you normally can type option A blood group A, option B blood group B, option C blood group ABO, and option D blood group A, blood group B, blood group AB, and blood group O. So the correct option is D. So short explanation is, in the ABO blood group system there are 4 main blood types based on presence or absence of A and B antigens on red blood cells. Subscribe now and press the bell icon. Never miss an update from a TECHNOLOGIST. If one of your parents is blood type A and the other blood type B, which of the following blood types would you likely be? Option A blood group A, option B blood group B, and option C blood group O, and option D blood group AB. So option E, all of the above. So the correct option is E, all of the above. Explanation: since blood type inheritance involves multiple possible genotypes, a child with one A parent and one B parent could inherit any of 4 blood type: blood type A, blood type B, blood type AB, or O, depending on the parents' exact genotypes. Which blood type can be transfused to an individual whose blood type is unknown? Option A AB positive, B AB negative, C O positive, and option D O negative. So this is so easy MCQs. So the correct option is option D, O negative. This is very important MCQs. Which of the following is used to determine blood type? Option A ABO blood antigen locus, option B RH factors, option C Lewis, and option D all of the above. So the correct option is D, all of the above. Which of the following statements is true regarding RH blood system? Option A, it was the first blood type system to be discovered. Option B, it is more complex genetically than the ABO system. And option C, there are 45 RH blood types. So the correct option is B, it is more complex genetically than the ABO blood system. This is so simple MCQs. The greatest medical problem with the RH blood group is option A transfusion incompatibility, B chronic anemia for RH negative individuals, option C chronic anemia for the RH positive individual, and option D none of the above. So the correct option is D, none of the above. The mother fetus RH blood type incompatibility problems can occur if the mother is dash and her fetus is dash. Option A RH positive and RH positive, B RH positive and RH negative, option C RH negative and Rh positive, and option D, Rh negative and Rh negative. So the correct option is C, Rh negative and Rh positive. So the mother Rh is negative and her fetus is Rh positive. Who is the greatest risk for the Rh mother fetus incompatibility problem is option A, European, B, Africans, C, Americans, and option D, all are equally at risk. So the correct option is A, Europeans. This is very important MCQs. When its mother Rh antibodies agglutinate a fetus blood, the severe anemia that results is called option A, immunization, B, ectopic pregnancy, C, erythroblastosis fetalis. So the correct option is C, erythroblastosis fetalis. So here, very short explanation is erythroblastosis fetalis, also called HDN, hemolytic disease of newborn, occur when a mother Rh antibodies attack to the red blood cells of her Rh positive fetus, causing severe anemia. This happens in case of Rh incompatibility. For example, the mother is Rh negative and the fetus is Rh positive. Right? Which of the following are true of mother fetus Rh incompatibility problems is option A, they can be prevented by injecting ROGAM into the mother's blood system, and option B, they are much less likely to be occur during the first pregnancy compared to later pregnancies, and option C, medical treatment can be nearly 100% effective in preventing such problems, and option D, all of the above. So the correct option is D, all of the above. Mother fetus incompatibility problems result from option A, the mother's antibodies agglutinating the fetus Rh positive red blood cells, option B, the fetus antibodies agglutinating its red blood cells, option C, the fetus antibodies agglutinating its mother's red blood cells. So the correct option is A, the mother's antibodies agglutinating the fetus Rh positive red blood cells. So this is very important MCQs. A couple expecting their second child is worried about Rh incompatibility. Their first child was Rh positive. They have their blood type. Which result would be cause for alarm? Option A, both parents Rh negative. B, both parents Rh positive. Option C, men Rh negative and women Rh positive. And option D, men Rh positive and women Rh negative. So the correct option is D, men Rh positive and women Rh negative. Antibodies for the ABO blood group are present option A on RBC, option B on WBCs, option C on platelets, and option D in plasma. So the correct option is D, in plasma. Antibodies for ABO blood group are present in plasma. Dear students, this is very important MCQs. The antigens for ABO and Rh blood groups are present option A on RBCs, B on WBCs, and option C on platelet, and option D in plasma. So the correct option is A, on RBCs. So the antigens for ABO and Rh blood groups are present on red blood cells. In the ABO blood system, you normally can type option A, blood group A, option B, blood group B, option C, blood group ABO, and option D, blood group A, B, AB, and O. So the correct option is D. classic example of codominance is option A, blood type O, option B, blood type A, option C, blood type B, and option D, blood type AB. So the correct option is D, blood type AB. Under which circumstances will an antigen antibodies reaction occur? Option A, a person with type O blood is given type A blood. Option B, a person with type A blood is given type O blood. Option C, a person with type AB blood is given type B blood. So the correct option is A, a person with type O blood is given type A blood. Right? Which of the following statements is true regarding ABO blood system? The first option is A, people who have the A antigen normally would not produce the anti-A antibody. Option B, type AB normally produce both anti-A and anti-B antibodies. So the correct option is A, people who have the A antigen normally would not produce the anti-A antibodies. Concerning the ABO blood group, a transfusion of AB blood may be given to a person who has a blood type is option A, blood group AB, option B, blood group B, option C, blood group O, and option D, blood group A. So the correct option is C, blood group O. Which antibodies are found in a person's plasma with type A blood? Option A, both anti-A and anti-B. Option B, anti-B but not anti-A. Option C, neither anti-A nor anti-B. And option D, anti-A but not anti-B. So the correct option is B, anti-B but not anti-A. Though this is very important MCQs, human blood types and the ABO blood group are identified by option A, clotting pictures in plasma, B, antigen antibody reactions, C, microscopic examination of white blood cells. So the correct option is B, antigen antibodies reactions. So here is the explanation. Human ABO blood type are determined by the presence or absence of specific antigen A and B on the surface of the red blood cells and corresponding antibodies in the plasma. When its mother Rh antibodies agglutinate a fetus blood, the severe anemia that results is called option A, immunization, B, ectopic pregnancy, C, erythroblastosis fetalis. So the correct option is C, erythroblastosis fetalis. Erythroblastosis fetalis, also called HDN, hemolytic disease of newborn, occur when the mother Rh antibodies attack to the red blood cells of her Rh positive fetus, causing severe anemia. This happens in case of Rh incompatibility. For example, the mother Rh negative and the fetus is Rh positive. Thank you for watching my videos.